Do you ever feel like your nights are no longer yours? You go to bed hoping for a full, restful sleep. But just as your body begins to relax, your eyes open again. Another trip to the bathroom. And then another. And before you know it, the night has become a cycle of waking, walking, and waiting to fall asleep again. At first, it seems like a small annoyance, just something that comes with age. But over time, those brief interruptions begin to steal something far more valuable than sleep. They rob you of your strength. They fog your memory. They strain your heart. And they silently wear down your body from the inside out. Because deep sleep isn't just rest. It's repaired. It's renewal. It's the time when your body heals, when your brain clears out waste, when your heart resets. And without it, every system in your body suffers, even if you don't feel it right away. And here's the truth few people will tell you: waking up to urinate multiple times each night is not just part of getting older. It's a sign. A signal. Your body is trying to tell you that something's wrong. In today's video, we'll uncover what's really causing these nightly awakenings. Not just the symptom, but the hidden imbalances behind it. And more importantly, we'll show you the practical steps to finally take back control of your nights, your energy, your mind, and your health, starting tonight. 1. Poor heart function or undiagnosed heart problems. This might shock you, but your heart health could be the real reason you're waking up to pee. Here's how it works. When your heart isn't pumping efficiently, your body struggles to circulate fluids during the day. So, what does it do? It pushes excess fluid into your lower body. Then, when you lie down at night, gravity shifts and your body begins to process that backed up fluid, sending it to your kidneys and bladder. That's why many people with hidden heart issues find themselves waking up 2, 3, even 4 times at night to urinate. It's not just annoying, it's dangerous, because frequent night urination may be one of the first warning signs of heart failure in seniors. You may not feel chest pain or breathlessness yet, but your bladder is already sounding the alarm. That's why if you have swollen ankles, fatigue, or difficulty sleeping flat, talk to your doctor immediately. Simple heart tests like an echocardiogram or BNP blood test can detect problems early. The good news: with proper care, lifestyle changes, and medication, your heart and bladder can both improve. Don't ignore this connection. Fixing your heart may be the key to sleeping through the night again and living a longer, stronger life. 2. Not managing blood sugar levels properly. Blood sugar levels have a direct connection to how often you pee, especially at night. When your blood sugar is too high, your kidneys try to flush the extra glucose through your urine. That means more fluid passing through your system, more strain on your bladder, and more frequent trips to the bathroom. For seniors, this is often an early warning sign of prediabetes or undiagnosed diabetes. Even if you haven't been officially diagnosed, poor diet and low activity can cause spikes that disturb your night. And since high blood sugar levels don't always cause pain or obvious symptoms, many seniors go months or years without knowing they're at risk. Here's the fix. Eat more fiber and fewer refined carbs. Avoid sugary snacks and white bread at dinner, and choose complex carbs like oats or vegetables instead. Also, ask your doctor for an HbA1c blood test if you haven't had one recently. It gives a clear picture of your blood sugar over time. Keeping your glucose in check helps your heart, kidneys, and bladder all at once. Nighttime urination might not be about your bladder at all. It could be your blood sugar screaming for help. And the sooner you act, the better you'll sleep. 3. Drinking hidden caffeine in the evening. Even if you stop drinking coffee after lunch, caffeine could still be sneaking into your evenings and keeping your bladder awake. Many seniors don't realize that certain teas, sodas, chocolates, and even decaf coffee still contain caffeine. Caffeine is a diuretic. It tells your kidneys to make more urine, and it can also irritate the bladder lining. That's double trouble for anyone already waking up to pee. If you're having dark chocolate after dinner, a cup of green tea, or a herbal drink that isn't actually caffeine-free, you may unknowingly be triggering your bladder. Even medications like pain relievers or cold medicines can contain caffeine. Always check the labels and aim to avoid any caffeine sources after 3 p.m. Instead, choose herbal teas like chamomile or rooibos that soothe your system rather than stimulate it. Your evening drink should help you relax and stay asleep, not wake you up with a full bladder. Keep a food and drink journal for a few nights and track your sleep and bathroom visits. You might be shocked how one small habit change can dramatically reduce your nighttime urination. Caffeine doesn't just affect your brain, it affects your bladder, too. 4. Ignoring signs of prostate or bladder problems. For many seniors, especially men, an enlarged prostate is the silent reason behind frequent night urination. As the prostate grows with age, it can press against the urethra and bladder, making it harder to empty fully. The result, you feel like you have to pee multiple times at night, even if your bladder isn't full. For women, it could be a weakened bladder or pelvic muscles after childbirth or menopause. Either way, your body is signaling something's not right, and ignoring it can lead to infections, bladder damage, or sleep disorders. What makes it worse is that these changes happen gradually. So many seniors dismiss them as just part of aging. But they're not. If you notice a weak urine stream, urgency, or a feeling of incomplete emptying, it's time to speak to your doctor. Tests are simple. Treatments are available and early action makes a big difference. Strengthening pelvic muscles with simple exercises and adjusting your fluid intake can also help. Don't let embarrassment or denial delay action. Bladder issues are common, but they're also treatable. Listen to your body. Catching prostate or bladder changes early can save your nights and protect your long-term urinary health. 5. Taking diuretics or blood pressure meds late. If you're on medications for high blood pressure or fluid retention, timing matters more than you think. Many seniors take diuretics, often called water pills, that help your body release excess sodium and water. While these are necessary for managing heart or kidney conditions, they also increase how much you pee. And if you're taking them in the evening or too close to bedtime, your body may be forced to flush out that extra fluid right when you're trying to sleep. The result? Multiple trips to the bathroom all night. Even some blood pressure medications that aren't diuretics can cause similar issues. The fix is usually simple. Talk to your doctor about adjusting the timing. In most cases, diuretics are best taken in the morning or early afternoon. That gives your body time to flush the fluid before bedtime. Never change your medication schedule without medical advice, but do bring this up at your next appointment. Also, keep a symptom diary for a few days. Note when you take your pills and how often you wake up at night. This small habit could uncover a major reason you're not sleeping well. Medication timing is often overlooked, but it's a common cause of nocturia in seniors. 6. Late-night salt and sugar cravings. That small salty snack or sweet bite before bed might feel harmless, but it could be causing your bladder to overwork at night. Both salt and sugar affect your body's fluid balance. Salt makes you thirsty and can lead to fluid retention. Then as you sleep and your body starts to process that salt, It releases stored water and sends it to the bladder, resulting in frequent urination. Sugar, on the other hand, increases urine production and can irritate the bladder lining, especially if you have diabetes or borderline blood sugar levels. Many seniors don't realize their nightly cravings are making their bladder hyperactive while they sleep. If you're having chips, crackers, sweets, or even salty nuts late in the evening, it's time to rethink your habits. Instead, choose a small protein-rich snack like a boiled egg or a few almonds. This helps stabilize your blood sugar overnight and reduces excess fluid shifting. Also, try to finish your dinner at least 3 hours before bed and avoid snacking after that unless it's necessary. Nighttime munching might seem small, but it's one of the most powerful triggers for nighttime urination. Change what you eat late at night in your bladder and your sleep will thank you. 7. Lack of physical movement during the day. You might be surprised, but sitting too much during the day can actually make you pee more at night. Here's how it works. When you're inactive, especially sitting for long hours, your body tends to hold on to fluids in your lower limbs. Then when you lie down at night, gravity shifts and those fluids return to the bloodstream, leading to increased urine production right when you're trying to rest. This is a big problem for many seniors who stay seated most of the day. By simply adding gentle movement throughout your day, you can reduce fluid retention and ease pressure on your bladder at night. It doesn't have to be intense. Just walking for 10 minutes every 2 hours or doing light leg lifts while seated can help your body process fluids more evenly. Also, elevating your legs for 20 minutes in the late afternoon can help release trapped fluids before bedtime. This means fewer nighttime bathroom trips and better, deeper sleep. Staying active isn't just good for your heart, it's key to bladder control, too. Don't underestimate how much your daily movement or lack of it affects your nights. A little motion during the day leads to more rest at night. 8. Emotional stress and anxiety. You may think your mind and your bladder are separate, but the truth is, they're deeply connected, especially at night. Emotional stress and anxiety activate your body's sympathetic nervous system, the same system responsible for the fight or flight response. And one of its effects? Triggering the bladder to empty. For many seniors, stress doesn't always come in the form of panic attacks. It's quieter. It might be financial worry, loneliness, grief, or fear of declining health. These emotions often surface at night when distractions fade and the mind becomes more active. And that internal unrest can lead to a hyperactive bladder, making you feel the urge to urinate even if your bladder isn't full. Meet Carlos, 72, who began experiencing nocturia shortly after losing his wife. Though his doctor found no urological issues, Carlos struggled with sadness and nighttime anxiety. After joining a grief support group and practicing nightly breathing exercises, his nighttime bathroom visits decreased dramatically. His story isn't unique, emotional healing often leads to physical relief. The solution? Create a calming bedtime routine. Turn off screens at least an hour before bed. Listen to soft music, try journaling, or practice deep breathing or meditation. Even gentle prayer of gratitude exercises can ease emotional tension. If stress persists, don't hesitate to seek professional help. Your peace of mind isn't a luxury, it's a part of your sleep hygiene. A calmer brain means a quieter bladder. 9. Cold bedroom temperatures. It sounds innocent, a cool bedroom, a breeze from the AC, or cold winter nights. But for seniors, sleeping in a chilly environment can actually be a physiological trigger for nighttime urination. This phenomenon, known as cold-induced diuresis, causes your blood vessels to constrict in response to cold temperatures. That increases your blood pressure slightly, which then prompts your kidneys to remove more fluid from your bloodstream and send it to your bladder. What does this mean in practice? Even if you didn't drink much water, the cold can still make your bladder more active at night. And since many seniors already have overactive bladders or reduced bladder capacity, this subtle shift in temperature can have a significant effect. You might find yourself waking to pee more often during colder months or after sleeping under too light covers. Consider Margaret, a 74-year-old widow from Illinois. She noticed her nighttime urination worsened each winter, despite no changes in diet or medication. When her daughter suggested warming up her room and using flannel sheets and thermal socks, Margaret was skeptical, but willing to try. Within days, her nightly wake-ups dropped from 3 to 1. Sometimes, it's not just what you drink, but how cold you sleep that matters. The fix is simple: aim for a bedroom temperature between 65 and 70 degrees Fahrenheit, 18 to 21 degrees Celsius. Use layers of breathable, insulating blankets and consider socks or a warm water bottle at your feet. A little warmth goes a long way in calming your bladder and preserving your rest. You don't have to accept restless nights as your new normal. Waking up multiple times to use the bathroom is not just a symptom of aging, it's a message from your body. A message that something needs to change. And the best part? Most of those changes are within your reach. Start tonight. Pay attention to your habits. Listen to your body. Protect your sleep like your health depends on it, because it does. Every hour of deep, uninterrupted rest is a gift to your heart, your brain, and your future. If this video opened your eyes to something you've been overlooking, don't let the insight stop here. Click the subscribe button now and join a growing community committed to aging smarter, stronger, and healthier. We're here every week with new tips, breakthroughs, and simple changes that can transform your life, one night, one habit, one breath at a time. And remember, better sleep isn't a dream. It's a choice. Make it tonight.